So Dr. Rowe, how long has penis augmentation been a thing and why is it so popular today?
Penis augmentations have always been a very popular procedure. It's just as of late, it's become a little bit easier to perform. Traditionally, a penis augmentation was performed via surgical procedure, and that involved a procedure to either lengthen the penis or a surgical procedure to augment the girth of the penis. There's very little you could do non-surgically with needles with an injection to augment the penis. As of late, that's changed with the advent of high hyaluronic acid fillers and also platelet-rich plasma. So given the fact that someone or a patient does not have to go to the operating room or have a surgical procedure done for their penis augmentation, it's become much more popular. And the procedure is very reliable. The fillers and the volumizers that we use to augment the penile girth are very reliable, and because of those two facts, it's become a very popular procedure as of late.
Okay. So how big are men requesting to go?
The one thing about the penile augmentation, there's two things that men ask me for. Is it possible to augment length, and is it possible to augment girth? The procedure that I perform augments the girth of the penis, the circumference of the penis. I don't really augment the length of the penis. There is some misinformation out there on the internet that if you augment the girth of the penis with a filler or a volumizer, that it will also increase the length, and that's just not true. It's kind of along the same line of thought. If you pull on your finger long enough, you'll stretch your finger. That just doesn't make sense. Penile augmentation with a filler really only augments the girth of the penis. How much of a girth improvement or increase does a patient want? Really, or what's the average? It's really as much as they want. The penile skin is actually quite incredible. It's made to stretch, so it can accommodate quite a bit of volume, quite a bit of augmentation. So really, how much are men requesting? It really is a very personal. Some men request quite a bit. Other men request just a little bit, or just change the shape of their penis. So it's really personal. I've had men request anything from 10 cc's all the way of a filler, and the fillers come in, we'll talk a little bit about that later. Fillers come in 1 cc aliquot. They come anywhere from 10 cc of filler all the way up to 30, 40, 50 cc's of filler.
Okay. So when a patient comes in, what types of questions would you ask them, Dr. Rowe?
Well, obviously when a patient comes in for a procedure, regardless of any procedure that's done in my office, we go through a full history and physical. We find out, obviously we find out what they want to try and accomplish, what their desires are. Then we do a full physical, we get a full history. We obviously check on what medications, what medical history someone has, what allergies someone has, what surgical procedures they have. Obviously, like I said, we want to make sure that everything is done safely and it's not going to harm the patient. So those are the type of questions that we ask. The type of questions they ask me, obviously we'll go over, but before we perform any procedure on any patient, we go over the patient's history, go over the physical, and make sure that we can try and accommodate what the patient wants.
Dr. Rowe, what are the different types of penile augmentations that you do perform?
That's a good question. Generally, I perform 2 different types of augmentation. The first one involves high hyaluronic acid fillers. Now, what high hyaluronic acid fillers, or HA, involves, there's HA in our skin, and all I'm doing is augmenting or putting more HA into the skin underneath the penis, which is a natural augmentation. You can put as much or as little as you want. The penile skin is kind of unique skin of the body in that it is made to stretch. So I've had patients come in where we put in 10 cc's, 20 cc's, 30 cc's. I've had patients come in starting off with 10 or 15 cc's injections, and then they'll come back at a later time and augment that. So that's the first type of filler. It's a natural filler. With that in mind, also the filler I use, the HA filler that I use, is a filler that lasts 2 years. There are a variety of different fillers on the market. Some fillers last 3 months, 6 months, 9 months, 1 year. I use the filler that lasts the longest. Now keep in mind, there are a variety of different hyaluronic acid or HA fillers on the market. They differ by how thick they are and how long they last in the body. Some fillers last 6 months, 9 months, or a year. The filler that I use for penile injection augmentation is a filler that lasts 2 years. So it's the longest lasting filler on the market. I find that most of my patients want a filler that gives them the longest longevity and effect. So most of our patients request that filler when we discuss the various options. The second type of injection that I do for the penis involves platelet-rich plasma. Now what platelet-rich plasma is, in our blood are red cells, white cells, platelets, a variety of different substances. We draw a patient's blood, just like when you go to the doctor and they draw your blood, and we separate out just the platelets. Then we take those platelets and inject it into the penis in order to improve the function of the penis. What we do is, what the platelets do, they help blood flow to the penis. And anytime you talk about something that increases blood flow to the penis, that does one thing, that increases function. This particular type of treatment, PRP, I use mainly for patients who have erectile dysfunction. It helps increase blood flow and helps function. It does require about 3 treatments, 1 month apart, and then a once annual treatment to maintain the effect. Keep in mind the HA filler treatment is kind of a one and done type of thing. If someone gets the size they want, they're kind of done. Whereas the PRP treatment does require those 3 treatments 1 month apart in order to get maximal effect. There are some people that talk about using PRP to augment the penis, to give it girth. I find that if I have to choose between PRP to augment the penis or HA, hyaluronic acid, to augment the penis, HA is a much better filler. It gives much more substantial size. The effect lasts longer, and I find that it gives you just again a much better effect. So I use PRP mainly for function, and I use platelet-rich plasma. I'm sorry, I use platelet-rich plasma mainly for function, and I use the hyaluronic acid fillers mainly for size increase. Now keep in mind, for both of these treatments, I do give 1 shot in the penis, at the base of the penis, to numb up the penis, and then we use a topical cream. So there is no pain involved in any of the treatment. The HA filler generally takes 20 minutes for the treatment, and the PRP treatment, because we do draw the blood and have to process it to get the platelets out of the blood, adds another 10 minutes to the process, so it takes about 30 minutes. Interestingly, keep in mind, you can do both procedures. Some men want an increase in size and an increase in their function. So there are patients in which we do both. And while I say I use it mainly for someone who has erectile dysfunction, there are men who don't have erectile dysfunction, but they just want added vigor and vitality, and they will use the PRP treatment or do the PRP treatment also.
So does this have any effect on you having possible children one day?
The treatments that we do will not impact your ability in the least to have children.
Okay, so what steps should one person take in preparation to undergo such a procedure?
Well, I think you need to do your homework. I think you need to make sure you go to a board-certified doctor to do your procedure. Do your homework. Go on the, ask your friends if someone has had that procedure, if they're happy with it. Go on your interviews with your doctors. And obviously I tell my patients, regardless of what procedure you haven't done, you have to be comfortable with the doctor during your procedure. He or she kind of becomes your best advocate. So you want to be comfortable with that person who is treating you. Don't always go for the cheapest price, because at the end of the day, you get what you pay for to a certain extent. And there are places I find in life where you can cut corners and places that you can't cut corners. In my opinion, I think a place that you do not cut corners involves your health. In addition to that, other than when you come here and we do your entire history and physical, I also suggest to patients that they refrain from using any type of anti-inflammatory, an aspirin, an Advil, because that can thin your blood. Now, it really doesn't impact the procedure. The only thing it may do is lead to a little bit more bruising, and you can get bruising with the procedure. But if you take an Advil before, for even as little as 1 tablet, it can lead to added bruising. Now, obviously, all bruising goes away, but obviously we try not to bruise the patient. Other than that, I tell patients there's really very few requirements. In addition to the treatment, after the treatment, I tell patients I want them to refrain from having any type of sexual activity for 48 hours. That's a little bit more holds true for the HA filler, a little bit less less of an issue with the PRP treatment. But definitely with the HA fillers, I ask them to refrain from sex for 48 hours.
So Dr. Rowe, how much do these procedures cost?
The PRP treatment starts off at $5,000 a treatment, and the HA filler treatment starts off at $1,500 per syringe. And again, generally, a patient can get injected with as much or as little of the HA as they'd like. Keep in mind the HA filler that I use is top of the line filler in that it's the longest lasting filler on the market. There are some fillers that are available that are a little bit more reasonable, but they just don't last as long. And I find that most of my patients, most of my men, just want a filler that last as long as possible. With regards to the PRP, the way we separate out the platelets from the blood, the method that we use separates out and purifies and gives us a very high concentration of what we call platelet-rich plasma, which gives you the best effect. There are some machines out there that mix platelet-rich plasma with platelet-poor plasma and gives you kind of a mix of the two. The way we separate it out is we take out even the platelet-poor plasma from the what we inject and just inject pure platelet-rich plasma in high concentrations. So we try and give our patients the best possible chance for success and happiness with our treatments.
Okay. So where exactly do you inject?
In the penis, we inject underneath into the penis to give it girth. We inject circumferentially around the penis. The only place I don't inject on the penis is on the bottom of the penis, because I find that if you increase girth there, you can block the urethra, which is where you urinate through. So we inject along the entire length of the penis, along all the sides of the penis, in order to increase the girth of the penis with the HA. As far as the PRP, we inject it into the body of the penis in order to try and increase the blood flow into the penis to increase function.
How important is it to visit a board-certified doctor?
I think it's very important. I think all of the viewers out there, any potential patients, you have to do your homework. You have to find a doctor that, one, you're comfortable with. I think you have to visit and make sure the doctor is board certified in that he is comfortable in doing what he says he can do. There are a lot of people out there that are making claims that they can augment the penis with little training and even fewer credentials to perform this procedure. So I think you just, again, need to do your homework, speak to friends who may have had the procedure done, find a doctor that they were comfortable with, and follow up on that. Go on a couple interviews, speak with a couple different doctors, three different doctors. You don't have to go with the first person you go on you visit. The main thing is do your homework, and I think once you do your homework, that diligence will pay off in the end.
Dr. Rowe, so per treatment, how much should one expect to grow?
That's a good question. It really depends on how much someone wants an increase, and that really depends on how much they want injected. Generally, most men start off with anywhere from 10 to 12 cc's per treatment, and with that type of with the HA treatment, I should say, and with that type of treatment, I generally tell patients that they can expect about a 2 centimeter, which is just shy of an inch, increase in the circumference of the penis along its entire length, which I think is substantial.
Dr. Rowe, how will this affect sexual performance?
It shouldn't perfect. It was more for how many treatments for size. Was that, or you changed it? I'm sorry. I'm sorry. Go back. I apologize.
No worries. So, Doctor. So, Dr. Rowe, how would this affect sexual performance?
That's a good question. Most of my patients relate that it improves sexual performance not only for them but for their partner. A lot of patients also ask, as an aside, will it affect their ability to have children at any point in the future? And that answer is no, it doesn't affect it in the least. I hope you find this video and some of our questions and answers very instructional and informative. I know it's a very sensitive topic, and I find that there's a lot of misinformation out there on the internet, and that's the main reason I kind of wanted to put the record straight. Obviously, if you have any further questions or would like to book an appointment to see me and discuss penile augmentations further, please do. You can visit my website at www.normanrowemd.com.